resources going into disadvantaged areas and to the federal community clinics to be able to proactively be able to test for this virus and find asymptomatic individuals. When someone gets sick with COVID, excuse me, when someone gets sick with COVID, you've heard the cases. Some of them have very high fevers. And so they're not out walking around. So they may have been shedding virus for 1 or 2 days before they got significantly ill and they had to be in bed because they felt so terrible. Now think of that. They were maybe out 2 days. And so if they're 50% of the cases, they're only out for 2 of the days that they may be spreading virus. An asymptomatic individual that doesn't know they have COVID, they may be spreading and shedding the entire time that they're in the community. So instead of 2 days, it may be 6 days, or it may be 7 days. And so when we talk about proportions, 35% that are asymptomatic that are out in the community is a much more opportunity for transmission than someone who is getting sick and is only out in the community for 2 days. And so we know we have to find both, and we've been working with states about what proactive surveillance would look like in this case to find people who are asymptomatic. But it's also why we continue to recommend to the public very clearly that you can't tell who's infected. And so that's why you have to continue to social distance. That's why you need to continue to maintain 6 feet apart. I remember in the early days of HIV, people told me all the time that they knew who was infected. And I would say, you don't know who's infected. I could be infected. You're just saying you don't think I'm infected because I look healthy. There's a lot of healthy people out there with COVID that look healthy. And so we're asking continuously for you all to be outside, to enjoy your Memorial Day weekend, to play golf, to hike, as Dr. Fauci said, to play tennis with mark balls, and to be out with your families that you have been in the household with, and to even consider sharing social distance space as long as you have utensils that belong to individuals and that maybe can be thrown out immediately. There's a lot of things to think through. I know you can do this. I know the American people can do it. And so please, as you go out this weekend, understand you can go out, you can be outside, you can play golf, you can play tennis with marked balls. You can go to the beaches if you stay 6 feet apart, but remember that is your space, and that's a space that you need to protect and ensure that you're social distance for others. Thank you.
I want to start by Dr. Birx, if I could have you stay here for just a moment or two. Zeke, I believe you emailed me a question about nursing homes and testing this morning. If you want to ask it, I'll have Dr. Birx give you an answer.
I think that's great. Thank you. Dr. Birx, last week, or 2 weeks ago, you and the Vice President of Governors, you wanted 100% of nursing home residents and staff tested within 2 weeks. Most states aren't going to meet that. Some 2 weeks later haven't even started to try, saying it's impractical and feasible. Are you disappointed? And also, what are the consequences of that inaction?
No, I know many of you don't know me. I'm a very aspirational and hopeful person that like to put out challenges because I think that's what needs to be done. You know, we've had it in the Open Up America guidance where we asked them to test all the nursing homes, nursing home residents and workers. We know that that group is very susceptible and has significant mortality. And so we continue to ask the states. We always look at the side of the ones who haven't been able to get it done. There are some that are getting it done. And I think what we will learn is from those who were able to get it done, how to do this more efficiently and effectively so that we can work together to ensure that not only we have the baseline testing, but we continuously test the workers within the homes to prevent any asymptomatic spread back to the residents once we show they're negative. We only have 1 million nursing home residents. We're testing way over 1 million people per week, getting closer to over 2 million people a week. So over that 4 million per 2 weeks, I was hoping that 1 million of those could be our nursing home residents. I think week over week, as we see testing expand, 1 million people a week. So over that 4 million per 2 weeks, I was hoping and 1 million of those could be our nursing home residents. I think week over week, as we see testing expand, it's not going to just be, and it's why I keep coming back to this, it's not the number of people you have tested. We see this all the time with other diseases. We have a lot of worried well that will come back frequently to get tested. We want to test, and we want states testing in areas where we know there's higher vulnerability to susceptibility to worse outcomes, like our nursing homes, areas where we know there have been outbreaks, such as prisons, meatpacking plants, particularly areas where people are transported to plants together or live together in a single residence or multiple residents, but there's multiple group home kind of housing situations. And among our inner